on both.
All right. Hi, everybody. Dr. Garrett Wegerif here at Pure Plastic Surgery. I'm a plastic and reconstructive surgeon. Today we're going to be doing Thursday Thoughts. I'm sure everybody sees my shirt here. It says Got Cellulite. This is one of our partners with Avily. This is a minimally invasive treatment for cellulite. And we're having an event here at the practice today for a few reasons. One, we became a platinum partner with them because we're the #1 practice in South Florida using their device. Also, we're going to be the designated training center for their device in the Southeast. So we're celebrating that in just a little bit here. But today I actually wanted to go over something in regards to what patients can expect during their recovery period for any surgery that they get here at Pure Plastic Surgery, or especially with me, and basically the post-operative appointment schedule, so you kind of get an idea of when you're going to be seeing us and how the intervals that we want you to follow up at. And then we're also going to talk about the resources available to you if you have any questions or concerns along the way, because we have a lot of those. We have a lot of support for our patients, and that's one of the things that I really think sets our practice apart from some of the others in South Florida. So first of all, you come, you have surgery with us. That is the beginning of the journey. It is not the end, which a lot of other practices kind of start to lose touch with their patients after the surgery is done. We need to get you through that recovery period, and it's really important for us to have great communication during that time, to have proper follow-up along the way to catch any little issues and address them before they become bigger problems. So what does that look like for us? If you have surgery with us, the following day, you're going to have a nurse visit virtually. You're going to have a video call with one of our nurses, and they're going to go over multiple things during that video call, and then you're also going to send in pictures of all of your surgical sites that your surgeon, me, is going to be reviewing to make sure I don't see any issues or concerns with those. Obviously, if you have any issues or concerns, you can come into the office for that first visit, but most of the time we're able to see you virtually on post-op day 1, make sure everything looks good, and then you see me on post-op day 5. So that gives you a little bit of time to recover. You don't need to leave your house or your Airbnb to come here on the first day. By 5 days, you're moving around a little bit better. That's when I see you in person. We're able to get a good look at everything, make sure there's no issues or concerns. Then after that, the next set scheduled follow-up in general is at the 6-week point. And if you're a local patient that lives close around the area, you come in and see me at 6 weeks. If you're an out-of-town patient, I would love to see you. You're welcome to come back and see me at 6 weeks, or you can do it virtually by sending in photos or having a virtual call with me if you have any questions or concerns. For patients that have breast procedures, especially with implants, I like to see you one more time in between that 5-day and that 6-week follow-up. I usually like to see it 3 weeks after surgery just to make sure that implants are settling evenly, in case we need to encourage massage on one side or the other to make sure everything is as even as possible during the recovery period. So these are all things that you can kind of expect when you get surgery with us. And then the final follow-up is at 3 months. And then that final follow-up is, again, if you're local, you come in and see me, and I get a good look at you. If not, we do it virtually, and you send in photos, and I'm able to review everything. What are the resources available to you if you have any questions or concerns along the way immediately post-operatively? So there's a few services that we have. One for non-urgent things where it's just you have a question about something that is not an emergency. We have a patient messaging center called Clara, where it sends HIPAA compliant messages to our staff here, and you can ask anything. They get back to you very quickly if it's within normal business hours. If not, it's the following day. But we always have a physician on call. So every day we have myself or one of the other physicians is on call to answer any questions that may come up that are a little bit more urgent or after normal business hours. So there's always a way to get a hold of one of us. Obviously, if you have an emergency that you feel like needs to be addressed right away, you go to the hospital. But we always have one of our staff on call to answer any questions that may arise after business hours. And Currently, what I'm doing with all of my patients is anyone I operate on, I check up on you the same night of the surgery, and you then have my cell phone number if you have any burning questions. And I'm going to continue that as long as it does not get abused by patients, which up to this point it has not. So we have a lot of ways for you to be in touch with us, and I never want that to be a concern of one of my patients, that they were kind of left stranded or anything like that. So I think we have a lot of things in place to prevent that from happening. So with all that being said, do we have any questions about the post-operative period and what you can expect, or about anything else?
Yes, there's plenty here. Can you please explain how is the scar for a breast reduction?
For a breast reduction, the scar is pretty much always going to be around the areola, down vertically, and then along the fold of the breast. And then how far along the fold of the breast depends on how much we're reducing and how much redundant skin you have out to the side. If it really stops right here, then it's usually from about here to here, but some patients have folds of skin that goes out a little bit further, and it may go back a little further.
How do I know that I need a lift or a lift with implants?
So that depends on what your goals are. If your goal is to have nice roundness and upper pole fullness of your breast, you probably need an implant to help you achieve that. A lift alone is going to reposition the nipple into the proper position, and it's going to give the breast nice shape, but it's not going to be able to provide the roundness to the upper pole of the breast.
What is the recovery time for a 360 body lift?
360 body lift is similar to what patients have for an abdominoplasty. That's about 2 weeks of, kind of being out of commission, probably not being able to go to work or anything like that. After 2 weeks, if you have a desk job, you should be able to go back to work. If you do anything with manual labor, there's lifting restrictions to 10 to 15 pounds for 8 weeks after surgery. And that recovery period, after 8 weeks, you pretty much have no more restrictions.
Do you recommend any specific brand for breast implants?
So we use Allergan products, and the breast implants are Natrel. And I love those implants. I think they're probably the best product available, and that is what we use for all of our implants.
Is there any way to have a tummy tuck with no drains?
Yes, I offer drainless tummy tucks. So there's a few criteria that you need to meet to be able to get that. You need to have a BMI of less than 32, and no previous major abdominal surgeries or liposuction, because that previous surgery or liposuction may lead to increased scar tissue that may make it difficult to do without drains.
Can you do a 360 body lift and a breast augmentation at the same time?
Yes.
How long should I have stayed in Miami after surgery?
Ideally, we want you here for at least 7 days after surgery.
Normally after a tummy tuck, how long until I can work out again?
So after a tummy tuck, because of the muscle repair, the diastasis repair, it's a minimum of 8 weeks of no significant working out. If you want to do very light cardio or walk through the park, that's fine at 2 to 3 weeks, but no core exercises, no lifting more than 20 pounds for at least 8 weeks after surgery.
Do you recommend patients bring inspiration photos of their goals?
Yeah, that's always a helpful tool.
How long approximately does the surgery for a breast lift with implants take?
About 2 to 2.5 hours.
After a tummy tuck, how long until I could work out again? Just answer that. Okay. Let's see. Thoughts about a drainless tummy tuck versus a standard tummy tuck with drains?
They're both great options, and I've had other videos where I've talked about the pros and cons of each. The pro of a drainless tummy tuck is you don't have drains and you don't have the frustration to deal with the drains that are coming out. It can cause some discomfort and just dealing with something that you need to record that output. And some people that are squeamish with body fluids and that kind of stuff, it's a great option. The one downside is it takes a little bit more time in the operating room because I'm placing additional layers of sutures, so the operative time is just a little bit longer and the cost is a little bit higher than the standard tummy tuck with drains.
What procedure would you recommend for excess skin on the thighs?
So that depends on exactly how much excess skin it is. If it's very, very mild, we can use something like Body Tight, which is minimally invasive. If it's more extensive, there's different types of thigh lifts we can do with traditional thigh lifts going up. If it's just excess skin in the top roll of the leg, we can do a crescent shape thigh lift where we're just taking a crescent shape of skin out of the upper crease of the thigh, and that scar hides a little better.
What are some complications during a tummy tuck procedure?
There's a lot of complications that can happen, but the most common ones are wound healing issues down near the center, and then sometimes little fluid collections such as a seroma or hematoma.
Is it a strict 6 weeks before entering bodies of water? Is it a strict 6 weeks before entering bodies of water after a mommy makeover?
Yeah, we really prefer that, and what that's referring to is getting, swimming at the beach or going into a public hot tub or anything like that. Even though the incisions may be closed, sometimes there's very small little areas that can still have openings that we want to be completely healed, so we make it a standard 6 weeks.
Okay, you answered that one. Let's see. So they're asking about the belly button. How do you make it look kind of like realistic?
So the belly button is your belly button. We're just relocating it to a new location after we pull all the skin tight. And how we make it look natural over time is by really trying to keep the scar hidden down deep. So I tack my belly button down to the muscle low so that the scar stays hidden within the belly button.
How long does the complete defined package procedure take, and how is the recovery time for that?
That can be a little variable from patient to patient, depending on exactly what you are going to require, but that can be in the range of 4 to 5 hours if you're really doing a lot of different areas and doing fat grafting to multiple areas. And the recovery is similar to what it is for a standard BBL.
Do you do fat transfer to the breast instead of implants?
I do fat transfer to the breast. The one thing to keep in mind with that is it typically is going to require more than one time to do it, because the amount of fat that survives long term is lower than when we transfer it to other parts of the body like the buttocks.
Are you seeing a lot of women coming in after weight loss from semaglutide?
Yes, that is definitely becoming more common. And the challenges associated with that versus patients who have had weight loss surgery are pretty similar, but one of the advantages to patients that have had weight loss with semaglutide is they typically don't have the vitamin deficiencies that some patients with weight loss surgery have, because they're not having malabsorptive procedures where it's difficult to get all those nutrients. A lot of questions today. Thank you, everybody. Appreciate it.
1 second. Just checking everyone here. The brands. Okay. Let's see. I'm waiting to see if any come in here.
All right, everybody. Thank you. I really appreciate it. If anyone's interested in a consultation, please look us up at pureplasticsurgery.com. You can get the process started there, and I'm happy to meet any one of you. Everybody have a great day. We'll see you next week.